Hello, I'm Sean Casey, and I'm the Clinical Director of the Heartland Pediatric Feeding Disorder Services. My primary job is to help families with children with feeding difficulties. Now, there are three things I want to talk to you guys about today. First is, what is the prevalence of feeding issues with children with autism? Second, why do feeding issues develop with children with autism? And three, and most importantly, how do we address it? How do you guys address it? Now, the first of these things is that the research has shown that over 60% of children with autism eat fewer than 20 food items as part of their normal diet. This is what we call food selectivity, and this is a very common thing for kids with autism. Now, food selectivity comes in two major forms. There are more, but these are the two major ones. Food selectivity by type, which consists of a child omitting complete food groups such as proteins and vegetables, but they'll eat all the fruits and starches that come along. Or like in the previous slide, that children will eat a few limited foods like chicken nuggets and macaroni and cheese, and that's it. And again, they're completely omitting entire food groups. Now, we also will have kids that have that present with texture selectivity. In this particular case, the child might eat certain meats, like they'll eat a hot dog because it's soft and spongy, but they won't eat a hamburger because it's dry and granular. Or they'll eat boiled carrots, but they won't eat boiled broccoli because it's floury. And so there's this texture difference between the two of them. So that's what constitutes food selectivity. But it really doesn't matter what the food selectivity is. They're both 100% treatable. Now, we're not sure why children actually develop food selectivity, but it's probably nothing that you're doing as a parent, because that wouldn't explain why over 60% of kids with autism have feeding difficulties. And so if that's the case across a diverse set of parents, then there's something particular with kids with autism that do this, and it's nothing really to do with what you're doing per se. More importantly is that there are strategies that have been shown to be tried and true and tested to be able to remedy food selectivity issues. So if we implement some of the strategies I'm going to talk about, we can prevent a small feeding problem from becoming a big feeding problem later on. So what are those strategies? Well, I'm going to give you 4 tips. There are many more things that you can do, but these are some simple things that you can implement right now that can help. The first of these is you have to offer new foods. Sometimes kids have shaped their parents to not even bother offering these food items any longer. So the idea here is that you can't eat something if you don't even get offered it. So the notion here is that we still have to continue to persist offering it. So if your child won't eat corn, don't stop offering corn, continue to offer corn, with the idea being is that sooner or later, maybe they will try it. So you have to persist with this. Now, parents will say, but he might not like it. And the answer is that might be true, but the research has shown, and this is from my colleague out at the Hershey Medical Center, Keith Williams and his group, is that children have to try something at least 15 separate times before we can evaluate whether they like or don't like something. When they simply say they don't like it, it's because that's a good strategy to make you take it away. But they don't know, we don't know if they like it or not, because they haven't even ever tried it. So we can't really take their word for it. So we still have to persist. And if they've tried it 15 separate times and they say they don't like it, then it's okay to remove that particular food item. So that's kind of his take on this. And then that actually bears out with my own work too. The second thing that you can do is when you're picking new foods, you don't have to go straight to broccoli if the child's only eaten toast, for example. If toast is one of the few items that your child will eat, then maybe we make some gradation changes from that. So instead of the toast being toasted on the 4 setting with a pat of butter on it, what if we toasted it with wheat toast as opposed to white toast and have them eat that? It's just a small variation to that, but we're going to kind of get them to eat that. If they won't eat that, they're not going to eat broccoli either. So if we make these small changes and we get them to come along with us there, then we can get them following forward with completely different food items. So you can try butter with jelly on the toast, or you can do bread with butter without any toast, or toast it at a different setting. There's a couple different ways you can do that. But the idea again is being the small changes to what they're already doing. Number 3 is that you can increase the tastiness of the foods. So one of the things that you can do is take a look at the inventory of things that they'll eat. And so, for example, if your child eats French fries with ketchup, maybe we can use ketchup for some other things. So maybe we use the ketchup with the broccoli, and if they dip the broccoli into the ketchup, they might eat that, or it'd be something that we can get them to try to do. Now, again, it sounds disgusting to you and me, but for the kid, that might be exactly what's necessary for them to try it, which is one of those 15 tries that we talked about above. And the final thing that I really want to talk about is having fixed meal lengths. One of the things that oftentimes I see with kids with autism is they come over, they eat their food, they scarf it down, and then they're off. Or they don't. They just kind of eat all day long, and there's really no set meal times. So one of the things here is have the very fixed meal lengths and fixed meal times. So set a meal time for 15 minutes or 20 minutes, and then from there, we'll see what actually happens with that. So we put the food down, the macaroni and cheese, chicken nuggets are on there, and a bite of broccoli. We then set a timer for 15 minutes and say, okay, you can get down after the 15 minutes goes or after you finish everything. They eat all their macaroni and cheese, they eat all of their chicken nuggets, and then there's sitting there is that one bite of broccoli, and they've got 11 minutes left on their timer. Well, they can either wait for those 11 minutes to go, or they're eyeing up their iPad over there and they can play with that if they just take this one bite of broccoli. Doesn't even have to be a big bite of broccoli. Just has to be that bite of broccoli. They eat it and then they get down. The idea being is that if they're going to be sitting there anyway, they might just try to take those food items. And so that's a very good tip to try to get them. And you don't have to go to a full pile of broccoli. Just one bite of broccoli is all we're looking for so they can get the flavor of it in and we can continue to persist with that. So these are 4 tips that you can do tomorrow that might help your kids in the future with getting them to try a wider variety of foods. So with that, I want to kind of summarize real quick. Number 1, really quick, you're not alone with this. Feeding issues are very common for kids with autism, and more importantly, it's very treatable. Second is that implementing a few of the ideas here might be useful. Now, you may have tried a couple of these ideas, but consistency is important. So continue to persist with offering these food items. I think that's going to be a big deal. Finally, I want to, again, thank St. Christopher's for inviting me to speak with you guys today, and I hope you enjoy the rest of the carnival. Thank you so much.